Okay, it looks like the number of participants joining has settled down. I am Robert McClellan, one of the collaborative co-chairs, and I'd like to welcome you on behalf of the Action Collaborative on Business Engagement in Building Healthy Communities to one of a series of continuing webinars that we have been having over the past few years and will be continuing through 2020. We are very fortunate today to have Dr. Nico Pronk with us to present his work on Healthy People 2030 and tell us with a particular focus on the role of business in building health and well-being. Dr. Pronk is currently president of the Health Partners Institute and chief science officer at Health Partners. And completely germane to today's topic is actually the co-chair of the U.S. Secretary of Health and Human Services Advisory Committee on National Health Promotion and Disease Prevention Objectives for the year 2030, known colloquially as the Healthy People 2030 project. He's also an adjunct professor of social and behavioral sciences at the Harvard School of Public Health. And his work over the years is focused on connecting evidence of effectiveness with practical applications of programs and practices, policies and systems that measurably improve population health and well-being. His work applies to the workplace, the health system setting, and the community, and involves development of new models to improve health and well-being at the research, practice, and policy levels. He's been widely published in both scientific and practice literatures, speaks internationally on population health and well-being, and started out with his doctorate degree in exercise physiology at Texas A&M University, and then completed his postdoctoral studies in behavioral medicine at the University of Pittsburgh Medical Center at the Western Psychiatric Institute and Clinic in Pittsburgh. And besides all that, he's just a great and fun guy. And so we're really very fortunate to have the opportunity to talk with him today. So Nico, it's over to you.
Great. Well, thank you very much, Bob. And it's great to be here with you all today, talk a little bit about the work that, that we've been engaged in over the past 3 years or so in ramping up the rollout towards the rollout of Healthy People 2030, which unfortunately has been postponed because of the coronavirus epidemic going on right now. So we're all dealing with our new reality these days, and clearly that has found its way into the rollout of our planning for this initiative as well. Well, why don't we get started with the next slide? Is it Carla or Alina? Great. So what I figured we would do today is spend a little bit of time talking about the background of Healthy People 2030 and tell you the kind of approach that we've taken in making recommendations to the Secretary. But then take that and apply it to the workplace setting. From a business perspective, take a look at this and look at potential indicators that may make sense for the workplace setting, but clearly then connect to the community indicators that are out there around which much of Healthy People 2030 is organized. The importance of stakeholder engagement is not lost on our committee. As we've worked over the past 3 years, actually since the first meeting that we had in late 2016, stakeholder engagement has been on the forefront of a lot of that work, with particularly focus on multi-sectoral action and partnerships, because really at the end of the day, in order to make any of these goals for the nation, to meet any of them, there has to be local action towards making progress. And so then we'll end up with a message that I think is appropriate to be sent to leaders across these different sectors. And then hopefully we'll have lots of time for questions and discussion. Next slide, please. So the Office of Disease Prevention and Health Promotion was created by Congress in 1976, and this office is really responsible for the coordination and implementation of the Healthy People 2030 efforts. This office does that work on behalf of the Secretary of Health and Human Services, and they are part of the Office of Assistant Secretary of Health. I must say that throughout the course of these past couple of years, the staff, the team that has been working with the advisory committee has just been absolutely phenomenal. It really shows the dedication and the commitment that the staff has to really make sure that we have the best goals set for health and well-being in our country. Next slide, please. So the Healthy People 2030 is used for a variety of reasons. There is a multitude of ways that this national agenda is used by different actors and users and across multiple sectors. Anything from using it for a teaching agenda at universities or continuing education efforts to clearly the idea that you can use an agenda like this to build a platform for state and local action. It's a strategic approach towards making sure that there is a framework that houses a national agenda regarding health, well-being, and achieving health equity. It is science-based, clearly data-driven, but data is really like the engine of this entire program. Measurable objectives with targets to be achieved by the end of the decade. And then it offers also a model for international, state, and local program planning. So other countries like Israel, Uruguay, among others, these are the type of countries that take a look at this program and then actually implement a similar approach within their own countries. Next slide, please. But it's going on 50 years now. Healthy People is part of the fabric now, I would say, of thinking about where to or how to think about skating towards the puck, so to speak, over the course of a decade. So the launch of Healthy People was really in 1979, which then introduced, after the Lalonde report in Canada, the Healthy People 1990 version, the first version. And at that time, there were 226 objectives that were associated with the program. Healthy People 20,000, Healthy People 2000 added a couple more objectives, up to 312. And then in 2010, it exploded in a sense towards about 1,000 objectives. Healthy People 2020 continued on with about a 1,200 set of objectives, close to 1,200, which led the secretary to rethink about this issue, because many of those objectives, even though they are supposed to be measurable, were actually lacking in measurement approaches. Also, based on feedback from the public, the secretary then charged the Healthy People 2030 committee to dramatically reduce the number of objectives. In fact, the charge that we got in late 2016 indicated that we should attempt to provide recommendations that will allow the number of objectives to be cut by more than half. So quick math tells us that we should shoot for less than 600. And I must say that I think based on the recommendations that the committee made, the federal interagency work groups have been able to end up at the current state of about 355 objectives, which is it's a huge task, and we'll talk about that here a little bit more. But the way that has been done, I think, has been a really good example of thinking through an approach that makes sense, is well balanced, and at the same time thinking differently about going forward. Next slide, please. So for Healthy People 2030 in particular, one of the first tasks that the advisory committee undertook was to really think about a framework that could hold all the pieces together. What do we really want this next 10 years to be about? And so one of our first reports was in fact a very short report, about a 5-page report that got an enormous amount of feedback from the public, and basically ended up being our framework as we refer to it. It's a vision and a mission that is clearly laid out. It's a vision of a society in which all people can achieve their full potential for health and well-being across the lifespan, and a mission to promote, strengthen, and evaluate the nation's efforts to improve the health and well-being of all people. What is new about these statements is that well-being is added to the idea of health. So as a team, we felt that we really do need to provide an approach to think more upstream. And when health comes into play, oftentimes health is being regarded as physical and mental health. But there are lots of other related contexts and environments and issues that affect health. So this idea of being more upstream in the effort that is being implemented, thinking about social determinants and determinants of health in general. The idea of expanding health to health and well-being was really sort of identified as an important concept to pursue. So health and well-being was defined in one of our briefs that we've sent up to the secretary as the way people think, feel, and function at both a personal and social level, and how they evaluate their life as a whole. And that allowed us really to open up the conversation towards going upstream and finding a way to bridge the gaps that are there between efforts that are organized around individual health issues and the more contextual and environmental issues that are upstream and considered to be determinants of health. Next slide, please. So to really graphically display what that framework really was all about, I think even though the framework is presented in a 5-page document as a report to the secretary, this slide really does represent that framework very nicely. It is all about health and well-being across the lifespan as the central objective, but that objective is linked to recognizing that there are physical, mental, and social dimensions to health and well-being, and that there is a need for access to quality public health and clinical care delivery systems. And of course, I think today's reality very much reflects that. But it is also recognizing that the urgent needs that are reflected today, very much with the coronavirus issues, do need to be balanced over time against the vital conditions that are necessary to have in order to optimize health and well-being across the lifespan for all people. Then there are a couple of different areas of focus. So cultivating healthier environments, recognizing that the physical environment, the social environment, and the economic environment have direct impacts on people's health and well-being. That there's a need to increase knowledge and action across a variety of areas, in particular recognizing the need for a shared responsibility for health and well-being across multiple sectors. That there are public health successes that indicate that there is evidence of effectiveness, if you will, that provide successful examples of how work can be done in these areas. That there is an opportunity for evidence-based law, policy, and practices that can be brought to the table in terms of solutions, and that there are clear objectives and data that can guide directional efforts to make sure that we, by the end of the decade, can have a successful effort underway. And then the idea of closing gaps, and there are specific, several areas of specific effort being outlined in the idea that we need to achieve closing gaps in health disparities, achieve health equity, and attain health literacy. And all of that work really is organized around data, data being the central construct of the Healthy People program. So that data needs to become actionable. It needs to become actionable at the local level, that there is a connection to evidence-based interventions. So if the data is available, you still need to find ways to align that with efforts and activities and actions that are evidence-based and informed by evidence, in terms of making sure that the resources you do apply are strategically placed and can be as effective as possible and efficient as possible. Next slide, please. So,
hang on a second, I'm not sure what happened. Sorry about that.
So the next slide, I'll just keep talking while you're working on the slides. The next slide is really discussing the evolution of the goals related to healthy people that over the 5 decades have morphed as well. In 1990, there were 2 goals, one related to decreasing mortality among infants across the life spectrum, and adults as well, and increasing independence among older adults. You can clearly see that over time, goals have sort of increased in number, but they've also gone upstream, and in particular, in the last 2 decades, starting to identify the importance of achieving health equity. And so in the Healthy People 2030 version, we have 5 goals, one related to attaining healthy, thriving lives and well-being, one related to elimination of health disparities, achievement of health equity and attainment of health literacy, creation of social, physical, and economic environments that promote health and well-being, promoting healthy development, healthy behaviors, and well-being across all life stages, and the engagement of leadership, key constituents, and the public across multiple sectors. This last one is particularly interesting in that it is a new one, and it is really focused on this idea that it's necessary to have goals and objectives, but it's not sufficient in the absence of action. We're not going to be able to do much in terms of achieving those goals and objectives. So the explicit inclusion of a goal that speaks particularly to multi-sectoral action and finding ways that allow different sectors to do their part and make sure that it's relevant to them is particularly important. Next slide, please. One of the ways in which the advisory committee was able, I think, to provide actionable guidance to the Federal Interagency Work Group to reduce the number of objectives from about 1,200 to less than 600 was the idea that we were able to reorganize and recategorize the objectives themselves. So our recommendation basically included the idea that there would be a set of core objectives, and those core objectives must all address the criteria associated with that, including that targets will be set and that there is in fact data available that allows for the the tracking, and the reporting of trends in these objectives. And that there are a set of other objectives that are important as well, but they wouldn't be counted in this subset of core objectives that really would then stay in the total number of being less than 600. First, there would be a set of developmental objectives. These would be objectives that really do need to develop more clearly their data sources, their data collection efforts, but they represent high priority issues that are important to the health and well-being of the nation. But they do not yet have a reliable baseline, and there may also be a lack of evidence-based interventions. And then finally, research objectives that would really focus on the need to advance research and develop an evidence base in areas that are important to health and well-being of the public. These objectives would represent significant opportunities for advancement in areas with limited research. They would also be inclusive of areas with a high degree of health or economic burden, whether that's preventable burden or otherwise, and evidence of substantial disparities between populations. So really it would allow for more efforts to really get to a place where once these core objectives show up, they do allow for a set of reporting on progress to meet the objectives and targets for the health and well-being of the public, but that they do have then in fact enough data to do such reporting. And that means, for example, that there is a baseline and that there are additional data points such that there can be reporting of trend, meaning 3 data points or more. Next slide, please. So in other words, there is an objective set of targets for Healthy People 2030 that have been proposed. Every measurable Healthy People objective has a 10-year target to be achieved by the end of the decade. The targets are aspirational, but yet achievable. And there are targets proposed by topic area co-leads and vetted by the agency representatives and policy and subject matter experts. And this is really the work that the Federal Interagency Work Group has done, which again, I would say has been just a phenomenal job. Just to think about reducing the 1,200 or so objectives to less than 600 is tough enough. They ended up with 355 at this point, which was what I would refer to as the draft set. And of course, because we haven't gotten to the launch yet, we are not sure what the final set will be. But to recognize that 55 objectives allows for enough expansion opportunity during the course of the decade to think about the developmental and research objectives to become a core objective. And that's really important because we added well-being to the health indicator only. When you go back into the history of Healthy People, it was always been organized around health indicators alone. And so well-being indicators are going to be in this area of developmental and research objectives in the first place. So by the time we hit 600 or so over the course of the decade, we kind of hope that that well-being will be the next set of core objectives as they show up in that grouping. Healthy People targets also reflect subject matter, policy, and political considerations and are therefore not strictly statistical constructs. And again, the Federal Interagency Work Groups has done just a great job of balancing all of these indicators to end up with a set of targets. The target setting process, however, was very much informed by what the advisory committee had recommended to the secretary, and that's the next slide. We aimed for making sure that there was transparency, greater transparency than in the past, a more systematic approach in target setting. that it would allow for replications of target setting methodology at the state and the local level. So in other words, as the state and local levels look at these objectives, how can they replicate that methodology so they can make these targets their own? Which would make, of course, the relevancy of these targets much more enhanced, so that the local level activities can really fit nicely. And it would also allow for targets to be considered using data-driven tools. The target setting methods include, there are 6 mentioned here: maintaining consistency with national programs, regulations, policies, and laws, maintaining a baseline, having a % improvement, a percentage point improvement, minimal statistical significance, and trend projections. These are methods of setting a target depending on the particular objective. There are other methods. There is a total of 9 that were recommended, including the one that our committee thought was the most important one, which was simulation or modeling. But simulation and modeling is not an easy methodology to apply, and particularly when the first area of focus is to reduce from 1,200 to less than 600 the number of objectives. That's not necessarily the methodology of choice at this point. So as we go forward, we hope that target setting methodologies will become more and more science-driven. Target setting documentation, including the justifications, the tools, the technical guidance, will all be provided at the Healthy People website after the launch, which has now, of course, been postponed until later in the year. Next slide, please. So to be specific, a little bit more specific to the workplace setting, if you review Healthy People 2020 and then you overlay that with the objectives to date that have been proposed under Healthy People 2030, then basically there are 12 proposed Healthy People 2030 topic areas that come from Healthy People 2020. They're directly related, and they are directly related to the workplace. These topic areas include educational and community-based programs, occupational safety and health, social determinants of health, as well as tobacco use. So there are a set of indicators available today that are specifically mentioning the workplace as a setting. There is also a set of proposal for leading health indicators that have been proposed in a report recently released by the National Academy of Medicine. If you haven't seen that report, I think it's a terrific, tremendously important report in terms of moving the recommendations for Healthy People 2030 forward. The report, I think, is very much aligned with the framework for Healthy People 2030, and the committee did, I think, a phenomenal job of balancing what the typical leading health indicators have been in the past to what the framework is asking for, and in supporting recommendations that have gone to the Secretary related to the key set of indicators that may well roll up as a shorter or smaller grouping of objectives that reflects the health and well-being of the nation. In addition to that, there is still work going on in the context of the foundation health measures. The big difference between these two areas of leading health indicators and foundation health measures is that the leading health indicators typically have been a subset of the objectives, whereas the foundation health measures could have gone beyond the objectives themselves. This is now a little bit clouded in the sense that the leading health indicator recommendations are also going beyond the objectives that are there today. And again, that's a reflection of the new categorization of core indicators, developmental indicator, core objectives, developmental objectives and research objectives as well. And then, of course, the cause of changing a definition from health to health and well-being. Data partnerships recommendations are also included in the advisory committee's recommendations to the secretary. And as I mentioned, that very much is related to the implementation subcommittee as well as the partnership subcommittee, both on the stakeholder subcommittee side as well as the data partnership subcommittee side. It is asking for increased data resources, establishing data guidance groups, establishing a data partnership network, and creating a Healthy People Data Partnership Learning Collaborative. We are, I think, as an advisory committee, excited about these particular recommendations because it allows for the connection, if you will, and the alignment of activities that are much more local, where a lot of this action will happen, and can be a great input and feedback mechanism for healthy people going forward. Next slide, please. There is also a connection to healthy people objectives in the international perspective. Here is an example of the National Academy's report on shorter lives and poorer health that came out a couple of years ago. This particular report actually outlines a set of objectives and compares that to performance in comparison to other nations. From the Healthy People 2020 set. And when you look at this includes general health status indicators, health-related quality of life and well-being, determinants of health as well as disparities. But basically, there is an opportunity here to also compare going forward the health and well-being of the United States to other countries and how do we stack up. Next slide, please. And that also considers an overlay, if you will, with the business and industry sector. So just picking one, life satisfaction, there is strong data available that correlates life satisfaction as a single indicator with well-being of people and populations. In this case, this is a report that reflects on the relationship of life satisfaction to household income, whether or not you smiled yesterday, whether or not you learned something yesterday, whether or not you have health problems, if you have the freedom to choose what you do with your life, whether or not you work hard and get ahead, whether or not you have the belief that you're getting ahead, having some college or diploma, employed full-time or unemployed, which is a negative indicator. And when you look at all of these indicators, there is a nice, I think, crosswalk to the definition of health and well-being that the Healthy People 2030 brief presents, which is that this notion that it's how people think, feel, and function, and how they evaluate their life as a whole. But all of these indicators are, in fact, relevant to the employer or workplace setting. You want people who feel good at work, who function well, and who are thinking their best self. Next slide, please. And so more recently, we have done some work. This is work that I collaborated with Matt Stiefel from Kaiser. And Matt and I took a look at the indicators that may make sense for the business and industry sector to start reporting on that would have a nice alignment between Healthy People 2030, but also some other efforts that are getting deeper into the community. So for example, the CDC's behavioral risk factor surveillance system, which is by and large implemented across all states, not always at the same time, but across all states. The Wellbeing in the Nation measurement framework, which has lots of agreement among many stakeholders on a specific set of measures which again provides enormous amount of leverage to start seeing specific indicators be actually measured at a local level, as well as some indicators related to the OECD countries. And these indicators may need to be adapted a bit to fit organizational context. For example, not all of these indicators have a definition of their measure that is specific to the work, to employer age, for example. So, you know, roughly 18 to 65 years old. Some of them are appropriate for children, or are inclusive of children, as well as retirees. But you get the idea that actually this is a fairly narrow, short set, not narrow, but short set of indicators across multiple dimensions that starts to really reflect what is important, and particularly with this notion of what's important at the workplace and what's important, how to connect to the issues that, that reflects the experiences of the employees as they go home in their life with their family, as well as their broader community. So while you could think of many, many indicators, this is a short set that we came up with, which will be coming out in the literature soon in the American Journal of Health Promotion. Next slide, please. So we mentioned stakeholder engagement early on as very much a critical component of the Healthy People 2030 Advisory Committee. We started out with the stakeholder engagement subcommittee very early on and got insights from many different stakeholders across the community. One of which was in fact the business community. We heard from quite a few and reached out to quite a few. But what is it really that we're asking for? And so both in the stakeholder engagement and the communication and implementation subcommittees, these recommendations have been made related to stakeholder engagement and how to engage over time. So that it isn't a recommendation that basically is one time and then let's see how we do at the end of the decade. But can it be an ongoing conversation, an ongoing dialogue? And this is where I think this idea of a data partnership network will be particularly powerful. So over time, we'll have an opportunity to continue this conversation with multiple stakeholders, including the business and industry sector. Next slide, please. And so one of the challenges will be that, and I think, you know, our current reality is a good example here. How can we make sure that public health leaders, business leaders can have an ongoing dialogue that is really organized both around the urgent needs that may evolve in our daily experience, as an example, the coronavirus, but balancing that against the needs to think more broadly and more upstream about what it means to have a scalable and sustainable solution for health and well-being for all. So a message to leaders would be to think more creatively around the need to connect, the need to partner, and the need to pursue an approach that is good for both parties. Making sure also that in the area of health equity, we make sure that there is no widening of health disparities at a minimum. Next slide, please. I mentioned earlier that Healthy People 2030 has also been used for the educational side. In this case, we have actually integrated Healthy People 2030 into a course on work, health, and well-being, focused on particularly the total worker health model that comes out of NIOSH at CDC, but also more broadly speaking, the connection that goes deeper into the community. Unfortunately, the decision was made very recently to cancel this program for this year. We will not be having an in-person course, and we're still thinking about potentially doing this in an online environment, but that will be done at a later date. So at this point, I think we can go to the, there is maybe one more slide. No, yeah, the thank you slide. I would encourage or would look forward to a bit of a dialogue right now, and hopefully we can get to the questions. But really already want to share my appreciation for being with you today.
Great. Thank you, Nico, for that terrific introduction to Healthy People 2030 and for your leadership in this and many, many other areas. We have a bunch of questions coming in. If you're not familiar with this, please scroll to the bottom of your screen and you'll find a chat box that you can send in your picture. So let me just start out with the comment that comes from Choma, and I think others are reflecting in their questions, is this broader view of health, well-being, and equity is so well integrated, and it's obviously the current crisis makes this interrelationship important, so clear. I'm wondering, Nico, just to take my prerogative as a facilitator here, if you could talk about whether the One Health construct has informed these indicators in any way, and how, again, that obviously One Health is so important to what's going on right now. And I think the WHO has, in their Millennial Development Goals, used this One Health construct. So could you just address that particular issue?
Well, so I would say that the framework has been the guiding light, if you will, for the entire 3 years or so that the advisory committee did its work, and that framework was designed to sort of think holistically about health and well-being. That you can't expect any one entity to take responsibility for health in the country and do that successfully, that it has to be a shared responsibility across multiple sectors, and these sectors need to be engaged. Health should not necessarily be the leader on every activity, but at the end of the day, there are other sectors that are just as important to health than perhaps the health sector itself. So so I think this broad view has guided the work of the Healthy People Committee very much so, thinking particularly about an integrated approach and an integrated whole, as Shoma stated that. So One Health is very much, I think, aligned. It may not have been specifically the framework that was guiding the work of the advisory committee throughout the course of the 3 years, but the underlying approach is very much in alignment.
Great, thanks. So let's get to the questions from our audience. So from Brian, he says, one assumption of engaging business in community health has been that it helps attract talent in a tight job market. So in this current setting with potential unemployment rates of up to 20% and all of the economic uncertainty related to the coronavirus, are there motivations for business leaders to focus energy and finances on community health rather than simply staying financially viable?
So I would go back to this idea that of what I would refer to as, you know, the message to leaders around creating shared value. I don't believe that Healthy People 2030 can provide specific objectives or metrics that will take care of every issue that any of the stakeholders deal with. But the idea that if you pursue an approach that is relevant to the local stakeholders, and in this case, business and industry working closely towards a connection deeper into the community than the walls that separate their own organization from the community. And aligning that with a set of goals and objectives that are laid out for the nation, that I believe gives you leverage. And whether or not that is in the space of financial health for individuals as opposed to financial health for organizations, this idea of creating shared value would allow you to actually organize that way. So it's very much in my mind about making sure that locally you've got the right drivers in place to pursue these efforts that align, that have a line of sight with indicators that show up among healthy people objectives. I kind of hope that that answers the question, but you know, it has to make sense from multiple perspectives. So financial viability of the company is absolutely critical, but so is financial viability for individuals within that company and their family on the outside. So it all comes together, which will be a strengthening of the community and the vitality of that community when an economic indicator like that is pursued. So that's kind of what I mean with this notion of creating shared value, that there's truly a benefit for the company, but also societal benefit at the same time.
Thanks. Question from Jen about whether or not there is a commute time metric of one sort or another. She points out that long commutes have been associated with poor quality of life and health and social civic engagement, et cetera.
So that one specifically, I'm not aware of. So the only objectives that we have seen so far have been the objectives that have been made available to the public for review. And until the launch, we won't know what the final objectives are. My assumption is that they're going to be pretty closely aligned. And then there may be another, probably another year or so before the leading health indicators and the foundation health measures will come out as well. So it may well be that there is going to be an indicator like that, but my guess is that it may be reflected in the developmental or research objectives otherwise.
Shoma actually responded to that particular question with a note that commute time is included in the WIN measures.
So that actually is an important message there from Shoma, is that, and it goes to this idea that if we have aligned efforts going on outside Healthy People 2030 that can pursue what is and in this case the WIN measures, having a measure that is agreed upon by so many stakeholders, then those stakeholders can continue to measure and report on those indicators. And eventually that indicator may line up with a couple of indicators within Healthy People 2030. It may be a physical activity indicator. It may be a sedentary behavior indicator. It may be meeting the guidance or the recommendations for physical activity. It may also be reflecting other indicators. So that is, I think, a way to start thinking about healthy people as we go forward into the future. There is a line of sight between those indicators that are being locally implemented and being relevant to the local situation, but recognizing that not everybody needs to measure that at the same time. It can be a roll-up over time.
Well, with respect to that, Meg actually brings up the question of local public-private partnerships to attempt to measure and track local or regional data. Do you envision that, or are you imagining that this data would be collected only at a higher level, or maybe just by some employers, or what are your thoughts about that?
Yeah, so actually that's what the Data Partnership Subcommittee has worked on, and in particular that question. You know, traditionally healthy people uses data coming from sources that are nationally representative. And those sources collect the data in a way that allows you to be confident that it reflects the nation as a whole, that it is a valid and a reliable source of information. And those things are important. But in today's world and the technology that we have on measurement, there may be all sorts of opportunities to think about this differently going forward. And that's one of the reasons why we believe that there is real benefit in having a network around data partnerships that would actually be able to pursue this over time. It can't be all fixed, you know, today, but as we go forward over the next decade, you know, 10 years from now, that technology is likely going to be vastly different than it is today. And today already we have so much data being collected on just about everybody and anything that goes on. Well, how do we use that data? How can that be mined to reflect areas of the country or census approaches that in fact may well be reflecting the nation as a whole, but still recognizing that the methodology of collecting that data is important to have confidence in the results.
Another data-related question from Bobby Milstein. He, as well as most people commenting, are delighted with the range of indicators you have. And he's particularly delighted with the potential measures of health promoting programs and policies. He wonders whether you could say more about how these programs and policies might be measured. For example, would it be a simple measure of their presence or absence, or perhaps something more detailed about their quality, their dose, or adequate funding?
I think it shows up in the recommendations a couple of different ways. One of them is, for example, the explicit recognition of increasing evidence-based policy and the use of law as an intervention tool. So what are the appropriate associated metrics that can be used to measure progress in those areas? That, you know, again, same example or same answer as the last discussion, in that today we have a set of metrics that have been reviewed and stands at 355 different ones. But as we go forward, these will be the type of measures that will need to show up in order to ensure that we have indicators that reflect the implementation of these kind of solutions. So programs, policies, use of law as examples. So we've made recommendations there. But again, I would say we need to wait a little bit to see where that all shows up in the metric set.
Great. That kind of leads logically to this next question from Jody Mitchell, and that is the area around business leadership. And has there been any work on that in terms of what that is going to look at? She mentions that so often when well-being is discussed, it's referred back to HR and wellness programming. However, for this to be part of business culture, connection needs to be made to economic factors such as workforce retention, recruitment, productivity, etc.
Well, this is actually this meeting today, this webinar is a good example, I think, of stimulating those ideas. The innovation collaborative of that you co-chair, Bob, is an example of moving that agenda forward. We need more leaders to be part of this dialogue but with an intentional focus on connecting it to public health in particular, thinking about that linkage to the community. And that means that public health leaders also need to think about that and think about ways to have these conversations among leaders that are organized around alignment and opportunity, rather than focusing on the challenges that maybe exist between public health and business as different sectors. So I think it's a leadership challenge on the business side on how business and industry connects to other sectors. It's also a challenge, I think, within a company. So the leadership within their own organization, how do they lead their human resource departments? How do they lead their operations areas to think differently about this? And how centrally do they position their people assets, their human capital assets in the context of how they operate as a business? So those questions need to be asked, all of them, and we need to continue that dialogue.
Yeah, and she continues, and there's actually an extensive chat conversation going on about this particular issue, but Jody goes on to saying that she believes certainly in creating shared value, but many companies don't connect directly to community-based programming where their workforce lives, works, plays, etc. Multiple businesses embark on multiple vendor programs for well-being initiatives that aren't connected or lack data reporting to see whether or not objectives are being met. And bottom line, as she asked this question, some of which you've answered, but you may want to say some more about it, is how can we influence and advocate for population health management as opposed to simply programmatic offerings?
Yeah, so perhaps I said it earlier in the way at least the way I look at it, is this multi-level kind of approach where it is important for the individual people to be able to achieve their best self and their best health and well-being. But then it needs to reflect also an intentional approach to make that happen at the level of the family, at the level of teams within an organization, groups, within the level of a community, within the level of a state, within the level of the nation, and then comparing us internationally. It needs to happen across these multiple levels at the same time. So in a sense, we need to have people as individuals participate, but also populations participate. And to me, the importance there is that the populations will allow you all sorts of leverage, to find all sorts of leverage, because the populations share cultures, microcultures, and interests that provide these opportunities for leverage. So I'm kind of hoping that sort of starts to get at the question, because really,
right,
probably lots of different ways to think about it.
Great. Well, there is, as I mentioned, a very robust conversation going on in the chat room, but we are at the top of the hour, and I'm going to have to close out the video portion of this. I do note that there are many resources that have been posted in this chat room, and I'll look to our colleagues from the NAM staff to collect those and make them available after this conference is over. But let me again thank you so much, Nico, for this stimulating introduction to Healthy People 2030. And let's look forward to 2030 as a group. Thanks a lot.
Thank you, Bob.
Bye-bye.
Bye-bye.